When we look at the most exciting combinations in head and neck cancer, it really comes from what we know about the biology of the disease. And what I mean by that is that for an anti-PD-1 drug to work, we know that an immune response has to have happened. Of course, the immune response is suppressed and the tumors are allowed to grow, but it is in that knowledge that we begin to rationalize combinations of immunotherapy agents. So we've got anti-PD-1 agents or anti-PD-L1 agents on one hand that are activating T cells, but when those T cells are at the tumor, they still may not be effective because they're being suppressed by so many other things in that tumor microenvironment. Tregs, myeloid-derived suppressor cells, macrophages, fibroblasts. And what we're seeing now, early days, is that the agents that can affect those other processes, so for instance, a STAT3 inhibitor that affects myeloid-derived suppressor cells, or an anti-KIR antibody that can affect Tregs and NK cells, or an IDO inhibitor that can affect both T cells and partially myeloid-derived suppressor cells, all of a sudden we're seeing a doubling or maybe even a tripling of response rates, with many of those responses being complete or near complete responses. Early days, but very exciting data.